one of the most common conditions we see in our practice are fungus toenails called mycotic nails. They are a disease. They're a true disease of the nail where the fungus lives in and under the nail and in the nail bed. The reason why it's so common is our feet are not supposed to be in shoes. Fungus is caused from sweating. It's like watering your lawn. If you water it too much and you water at night, mushrooms grow. Fungus loves dark and wet environment, and that's why we see it on the nails. It's also part of the aging process, all for various reasons, also very common in diabetics. There's various ways to treat it, but it absolutely should be treated since it's a disease. It is progressive. It will get worse. I often hear from patients, I heard that medication, Lamisil, other oral medications can hurt you. They work, and it's an extremely rare episode where a patient has a problem or should not be on it, and that's why we do blood work and other things. But the vast majority of patients don't want to go on a medication, and we have a we have a toolkit. You need a multi-disciplined approach to get fungus toenails better. Some people say, well, topicals don't work, stuff you paint on. And we treat the feet, we treat the shoes. There's some minerals that you can take, and we have a way to get fungus toenails significantly better. Now, the topical modalities we just spoke about generally will not get rid of them totally in the vast majority of cases. But you should treat this disease because it will get worse. And when it gets worse, it's harder to get. The worse it is, the harder it is to get better, number one. Number two, in cases of diabetics, the fungus toenails can often cause breaks in the skin known as ulcerations, and that's how we run into infections, loss of toes, and things like that. So simple prevention can help this. And again, we want to help you not pass it on to whether it be your spouse, your siblings, anybody else in your household. So it's all about education, but you need to treat it. And again, some people like to treat it with the medication, and that should eradicate it, but there are many, many other ways. We get a lot of questions now about the lasers for nail, and at this point there's not one that's FDA approved totally for treatment of fungus toenails, and until that time comes, until we see long-term studies, we're not going to go out there and gouge our patients and charge them for something that we don't believe in. You can email us anytime on our website with any questions. We're always here for you.